Greetings. I am Wanjun Lee, Senior Manager at Korea Chambers of Commerce and Industry. On behalf of KCCI, I would first like to offer my full support to your esteemed nation and hope for a swift end to the COVID-19 pandemic. I am here today to share Korea's experience in fighting COVID-19 and offer recommendations for the construction industry. I sincerely hope that this information will help others in their efforts to prevent the spread of the virus while minimizing disruptions to the economy. My remarks today will follow this order. First, an introduction to the current status of COVID-19 in Korea. Second, I shall share Korea's lessons in fighting the pandemic. Third, a comparison of major countries' approach to testing. Fourth, I would like to share a video that sums up Korea's efforts in fighting the pandemic. Lastly, I shall offer recommendations to the construction industry, citing guidelines drawn up by the Korean Ministry of Land, Infrastructure, and Transport. First, the current status of COVID-19 in South Korea. Korea's aggregate number of confirmed cases amount to 10,591, while the death toll is 225 in total. Keeping in mind that Korea was one of the most severely hit victims of COVID-19, the recent decline of confirmed cases per day of under 50 persons is a good sign. Furthermore, from early April, 50% of confirmed cases per day involved travelers from overseas. I would also like to note that we have seen relatively even distribution of infections according to age group, while the rate of fatality was kept under 3%. Low fatality rate is one reason that the Korean population did not fall into panic even at the peak of the pandemic. I believe that we can sum up Korea's core response strategy with the following keywords: test, trace, and treat. First, test. Robust diagnostic testing capability is a major factor in Korea's fight against COVID-19. Our current diagnostic testing capability is up to 20,000 tests per day. This was possible due to fast-track authorization of test kits developed by biotech companies, rapid transfer of technology to relevant sectors, and close cooperation between public and private institutions. Currently, COVID-19 tests are conducted at 118 testing institutions across the country. The Korean government ensured that testing was easily and readily accessible to the public by introducing drive-through and phone booth testing stations. The second keyword is trace. The Korean government is vigorously tracking those who have been in contact with confirmed cases. Any contacts identified through investigations are tested for COVID-19, put under self-quarantine, and are monitored via smartphone applications. The last keyword is treat. As COVID-19 infection can manifest with mild or no symptoms, the Korean government prioritized early detection through rigorous contact tracing, followed by treatment at the earliest possible stage to increase recovery rates. At the beginning of the outbreak, all confirmed patients were placed into hospitals to prevent community spread. To make sure that critical care resources were available for those in serious conditions, the government designated 67 hospitals to exclusively treat COVID-19 patients. Now, a brief comparison of COVID-19 testing. Korea implemented a strategy of testing symptomatic and asymptomatic cases alike, made possible by a vigorous approach to testing. In comparison, other major countries only tested cases with respiratory symptoms. The difference in approach can be seen in the relatively low rates of persons tested positive, low patient death toll, and death rates. To sum up Korea's experience in fighting COVID-19, I would like to share a part of Vox Media's report, The Big Lesson from South Korea's Coronavirus Response.
2019, China reported the first case of the coronavirus. In the following weeks, as the outbreak started spreading across the world, South Korea only had 30 confirmed cases of the virus. But despite the low numbers, health authorities had already started working with biotech companies to develop a test for the novel coronavirus. And soon, they had thousands of test kits ready to go.
Lesson learned from MERS outbreak in 2015. First one is the diagnostic test is very essential. We developed a lot of diagnostic tests and distribute in every hospital.
They prepared for the worst, and the worst quickly followed. By late February, the total number of coronavirus cases rose dramatically, crossing 3,000. This made South Korea's outbreak the largest outside of mainland China. And it all started here, in Daegu, where a woman went to the hospital with a fever. Because the government had already equipped hospitals with coronavirus tests, doctors were able to test her. She tested positive and became known as Patient 31. But the testing didn't stop there. While she was sick, Patient 31 had gone to a megachurch where she sat with a congregation of hundreds for more than an hour. So they traced her movements, identified people she had come into contact with, and then tested those people as well, whether they showed symptoms or not. Many of them also tested positive, so they were quickly isolated and treated at home or at a center. And then all the people they had been in contact with were traced and tested too. This is called contact tracing. It's an approach that allowed Korea to test over 9,000 people who had been in contact with someone who had tested positive. After Daegu, Korea ramped up testing around the country. Private and national healthcare systems joined forces to set up a mostly free testing effort that includes more than 600 locations that screen as many as 20,000 people per day. Through this system, when anyone tests positive, the government is able to test and trace their contacts to continue to break the transmission chains of the coronavirus on a large scale. But that's just the human-to-human transmission. The infected person may have moved through the city, touching subway poles and door handles. And South Korea had prepared for this too. After the MERS outbreak, when they weren't able to trace the movements of the virus, Korea changed the law, allowing the government to collect a patient's data and security footage during an outbreak. All their steps are logged and then shared to alert people to stay away from the path of infection.
If there is some confirmed case found near my office, they message via smartphone, there is a confirmed case near your place. He moved some place to another place. Be cautious.
Websites and private apps compile that information, allowing everyone to see if a person with a confirmed case of coronavirus went to a pharmacy or the hospital or anywhere else. And they'll know how recently they went too.
It's a means of checking the possibility of infection.
Citizens are checking the coronavirus locations and are avoiding going to these areas.
This information lets people know if they've crossed paths with an infected person, so they can go get tested for the virus. And contact tracing starts all over again. Tracing people's every move can be controversial, but many in South Korea prioritize public health over privacy in an outbreak.
남에게 전염시켜줄 수 있다는 그런 특성 때문에 개인의 인권보다는 공익적인 그런 요인에 대한 걸 많이 강조하는 그런 경향이 있는 건 사실입니다.
As a result, South Korea was able to test hundreds of thousands of people, more than any other country at the time. And this made it easier for authorities to see the virus, to see where it's located and where it may be lurking. This ability to find and treat infected people has allowed Korea to avoid aggressive lockdowns. And it's helped bend the curve of the outbreak that started out dangerously steep. For now, Korea has turned a corner, but they continue to be prepared.
We are very cautious to prevent the second wave. Every day is the kind of state of war.
It's that kind of vigilance that has set Korea apart in the coronavirus pandemic. But it wasn't the only place to test people aggressively. Singapore, Taiwan, and other neighbors saw the benefits of widespread testing too. Now countries like Germany and the UK are starting to implement aggressive testing, and even the US, where the government has failed to provide adequate testing, is now scrambling to test more people.
We know that we have to do more, and we continue to accelerate in testing.
Korea's strategy of contact tracing might not be easy to replicate in countries with much larger populations. But the country's success with widespread testing still offers a way out for most countries that are stuck in lockdowns.
For the remainder of my time, I would like to offer recommendations for the construction industry. According to the COVID-19 response guideline of the Korean Ministry of Land, Infrastructure, and Transport, 2 focal points of combating COVID-19 is first, labor and material management, and second, implementing precautionary measures in construction sites. First, labor and material management. The dissemination of information and close monitoring of construction environment are pivotal. Managers must instruct employees on the details regarding symptoms and rules of prevention, such as maintaining distance and social hygiene. Taking the temperatures of workers and visitors regularly, while monitoring access to construction sites by implementing tracking logs that record movement of personnel, are other points that must not be overlooked. Lastly, in the case of infection in the workplace, construction firms must make sure employees comply to quarantine measures. Also, maintaining a steady supply of labor and materials is important, because the pandemic can greatly limit movement of personnel and resources. My second recommendation is precautionary measures. One factor that was crucial in preventing the spread of COVID-19 in Korea was proper distribution and usage of masks and maintaining social distance. Businesses should ensure that employees wear masks while minimizing group activities. Also, rigorous disinfection of construction sites is a must, and all employees should maintain personal hygiene in the workplace. Lastly, construction firms are advised to establish a hotline with local medical authorities, especially those designated to the treatment of COVID-19 patients. Well, that concludes my speech for today. The international community is facing an unprecedented global crisis with the spread of COVID-19. I sincerely hope that this information I shared today will help others in their fight against COVID-19. Thank you.